The title Carotid Endarterectomy is written in white chalk-like font on a dark gray chalkboard background. A man in a dark suit and yellow tie stands in front of a split background. The left side shows an abstract, warm-toned image of blood cells and vessel walls. The right side displays a transparent human torso with a detailed rendering of the heart and major blood vessels in blue and red. Text appears, Eric A. Marvin, DO Neurosurgery Carilion Clinic.
Hello, my name is Eric Marvin. I'm a neurosurgeon at Virginia Tech Carilion Clinic, and today I'd like to talk to you about carotid endarterectomies, specifically carotid stenosis.
An animated cross-section of a blood vessel shows red blood cells flowing past a yellow plaque buildup on the vessel wall. Text overlays the image. Stroke is the leading cause of death and morbidity in people over the age of 60.
Stroke is a leading cause of death and morbidity in people over the age of 60. And some of these strokes can be prevented.
A detailed 3D rendering of the human brain's intricate network of arteries and veins, depicted in golden and reddish hues against a black background.
During the workup of a stroke, the studies that we'll usually obtain including an MRI of the brain, as well as vascular studies of the
A medical scan of the neck and head shows blood vessels in red and blue against a purple background. A green line traces a vessel, and an arrow points to a constricted area. Text Carotis L is visible.
heart and the neck.
An animated close-up of a blood vessel cross-section reveals thick yellow plaque lining the inner wall, severely narrowing the channel through which red blood cells flow.
In some scenarios, we'll find plaque that has been built up into the carotid arteries. The carotid arteries are very large arteries that go to the brain and are found in the neck.
An infographic titled Atherosclerosis shows a cross-section of a blood vessel with a yellow plaque buildup. Green arrows indicate pressure on the vessel wall. Below, text defines blood pressure.
And they can become hardened in a disease process that we call atherosclerosis. In the setting of atherosclerosis, the carotid arteries can be a risk factor for stroke. This happens when either the carotid artery becomes very stenotic and blood fails to reach the brain, or little plaques or blood clots break off and float downstream to essentially occlude one of the blood vessels, causing an area of infarct or stroke.
A highly magnified animated view inside a blood vessel shows a large, irregular yellow plaque. Red blood cells are clumped behind it, and smaller red particles are breaking off and flowing downstream.
One of the surgical procedures that we have to offer patients with carotid stenosis is called a carotid endarterectomy.
An animated, blurred close-up of a blood vessel with internal plaque and flowing red blood cells. The text Carotid endarterectomy appears clearly in white.
Carotid endarterectomy is a procedure where we essentially open up the vessel and remove the plaque. In certain situations where patients are either having symptomatic stenosis or patients have a very tight stenosis and have not yet had symptoms but are at risk, we will potentially offer a procedure to alleviate the risk of stroke in the future. A carotid endarterectomy are oftentimes a prophylactic procedure to prevent a larger problem downstream.
A medical angiogram displays a dark, winding blood vessel with a significant narrowing or blockage, indicated by a white arrow pointing to the constricted area. The background is blurred blue with abstract medical shapes.
We feel that in certain patients, this can be a very valuable procedure in alleviating a major detriment to them down the road.
Two medical images are shown side by side. The left is an angiogram of neck vessels with an arrow pointing to a narrowed section. The right is a cross-sectional image of a vessel, also with an arrow indicating plaque.
In dealing with carotid artery stenosis, there are two procedures that can be entertained. One is a surgical removal of the plaque.
An animated cross-section of a blood vessel with yellow plaque shows a mesh-like stent expanding to open the narrowed passage, allowing red blood cells to flow freely.
The other is actually putting a stent into the carotid and opening the carotid from within the artery itself. Both of these procedures are offered at Carilion Clinic.
A medical angiogram shows a clear, open blood vessel after intervention, with an arrow pointing to the previously constricted area, now widened.
Some people are predisposed to atherosclerosis. As we see in the heart vessels, this can happen in the vessels of the neck, leading to the brain as well. The treatment of carotid stenosis and strokes in general will often involve lifestyle changes, different types of eating habit changes, and exercise.
A white plate holds a healthy meal of grilled salmon, asparagus, and cherry tomatoes on a white wooden table. A small dish of dressing and a spice grinder are also visible. Several people are exercising on stationary bikes in a gym. A smiling man in the foreground looks at a tablet mounted on his bike's handlebars.
In addition, we will often use medications such as antiplatelets, including aspirin and stronger antiplatelet medications to help keep the flow of the blood smooth so that there isn't blood clots that can form and break off.
Two white, oval-shaped pills with aspirin embossed on them rest on a light gray surface. An animated view of a blood vessel shows numerous red blood cells flowing smoothly. In the background, a transparent human body displays the heart and vascular system, including those leading to the brain,
and travel downstream to cause strokes. In the event that a carotid artery stenosis is either symptomatic or very significant, and especially worsening on subsequent imaging, we will often recommend endarterectomy to prevent problems down the road.
A medical angiogram of the head and neck shows a complex network of blood vessels. An arrow points to a specific area of interest within a vessel.
Thank you for joining me on this topic. Goodbye.